some time away from our favorite community representatives in postpartum and newborn care, both Yolanda Fortin, who's here as a lactation consultant, and Elaine Kopinga, who's here as a nurse practitioner and certified nurse midwife. I'm going to give a short background on both of them. Welcome. Thank you for being here.
Thank you for having us.
Thank you for having us.
This is not a small feat to get busy professionals to make some time. We always make time for the newborns, but to conversate with the populace is a little bit more challenging because it's not commonly done these days.
Yes.
With the quarantine. Mm-hmm. But both of you guys are truly committed to helping the community and speaking to new moms and new mom groups. So I'm grateful for that. Let's start with Elaine. You have a novel approach to care, melding practices that have worked for women for centuries with modern evidence-based research. Thank you. And as in your practices, you've worked at large teaching hospitals and boutique practices serving both high and low risk populations. You've completed hundreds of deliveries and have a deep understanding of the challenges facing women after childbirth. Your past has shaped your ongoing focus on combining women's health with postpartum care. You are now a part of a wonderful company called the Cradle Company that's established itself and growing in Orange County, and you can find more on her in the comments below and in the summary here at the Cradle Company. Yolanda, I've had the pleasure of working with years ago and was able to attend her newborn course classes with my husband for myself, and then was able to convince her to help teach at some of my newborn classes, and has really been a blessing to many patients in the community. She completed her lactation education and internship at University of California, San Diego. She says that was a very humbling experience, and it was amazing, incredible period of growth. She works primarily as a lactation and very busy lactation consultant in a hospital and private practice. And she has served as a lactation consultant for several OBs and pediatricians. She was an educator and wrote curriculum for Soul Food for Your Baby. So she is available, and you can read more about her on PhD. Is it Milk PhD?
PhD Milk.
PhD Milk on Facebook. Are you on Instagram?
Not professionally, no.
Okay. So we're going to start with our first topic, which is right here, tips on how to be successful with breastfeeding in the newborn period. And when I say tips, I'm including commonly missed problems and how do you get your baby to grow, how important it is to grow, and is it okay if they lose weight? So this is something you speak on all the time, so I'll let you take it from here.
Oh, wow. Okay. So generally, if somebody asks me tips on how to get breastfeeding off the ground, they're asking during pregnancy. So I try to think of what I would want to let them know during their pregnancy so that they're prepared for postpartum breastfeeding. And the first thing I would let them actually know is that you can do it. You can. I think that we as a population have a tendency to lean on the negative stories, the things that were not necessarily successful. And we also have a tendency not to trust our bodies as women. I don't know why that's the default position, but it is. It's amazing how many women grow a whole human being or two within their body. You grow an organ and then you grow a human being within your body or two, and then deliver this baby, because we prepare for this. We take a lot of childbirth classes, right? We maybe take some baby care classes. Deliver the baby, and then all of a sudden we do not trust our bodies to nourish that child that we just grew, or those children that we just grew. It's like all of a sudden we're like, nope, I can't do it. So, trusting the body is, I think, essential. Having some faith that you can do it is the start, because a lot of the times if you walk in and deliver your baby and you're like, oh, maybe I'll do it, then any little struggle that comes up, we have a tendency to quit. So I think you guys would agree that that's probably the case.
Absolutely.
Yeah.
Absolutely.
But I distinguish people who are willing to use some formula while they're in real deep struggle. Because I actually don't know what's going to come of a parent who comes to say, if it works, it works. If it doesn't, I think it's their personality. Some people need to know that it's not an all in, all out, and that they can get a little help in the first week.
Absolutely.
And I've been surprised that they just wean. Some people, that's just downhill. They're just going to do the formula, but others can use it and wean. So knowing that you can do this and there is some help, it's not the end of the world to use the formula.
Exactly.
Absolutely.
It is. I think that the one thing with breastfeeding that you're absolutely right. If a mom is truly, a lot of people do come to the table like, oh, we'll try it and see how it works out. Other people come to the table like, oh yeah, I'm going to do it. This is what I'm going to do. I've decided. And then if it doesn't work out, they completely give up. And there's all the shades of gray in the middle. All the shades of gray. You have moms that literally give all formula except for one breastfeed, maybe that's direct breastfeeding or pump, or you have the opposite. You have moms that literally give all the breast milk, but then there are those 1 or 2 feedings that end up being a formula feed. Yeah. And then there's this thing called bridge formula. So someone who is in the process of waiting for their milk to come in, but maybe the baby's demanding more, maybe there's an illness or medical condition that this baby needs more milk. We give formula for that time, and then we stop. So there are so many different ways to do this that, you know, I'm just like, have some faith that we're going to get to whatever goal you have. Because those goals are all over the place.
Absolutely. And, you know, I think if I could just kind of piggyback on what Yolanda was saying, that, you know, it's important to have faith that you can do it. You know, you grew this baby, or babies, in my case, babies, and it's important to have faith that you can do it. But I also think it's important to know that there may be some challenges and hiccups in the beginning. And just because you're having some challenges doesn't mean that you're not successful as a mother. It doesn't mean that you'll never breastfeed. I know with my twins, some of the best advice that I got from my pediatrician, she said, you know, they came a little bit early, so we know that can affect their ability to nurse. So she said, you know, and they were, you know, skinny little things. So she said, just keep putting them to the breast, even though you're pumping and even though you're augmenting with a little bit of formula, because they needed that extra calories. She said, just keep putting them to the breast. And one day it will click and it will happen. And I can tell you, she gets a bottle of champagne every year because I've never forgotten that. That was just important, even for me as a midwife, to know just keep doing it, because eventually it will click for them.
It clicks. It does click.
Yeah.
Yeah. And there are 1,000 different reasons why there may be a challenge. And sometimes we can put our finger on why this isn't working. And then we have times where we're like, I just don't know why this isn't working out. But a lot of times, if you kind of go back to basics, skin to skin, keep putting your baby to breast, every day that baby grows. And as they grow, they get better and better and better. So, you know, one of the things that I always teach in my classes is that breastfeeding is natural and intuitive, and we're supposed to do it. And da, 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 da. However, it's also a learned behavior.
Yes.
So just like walking and talking and crawling and all of the stages that we go through, we have to learn it. And a lot of times we take for granted. We're like, oh no, it's just supposed to click. And if it doesn't click, then it's broken. No, it takes a little time for 2 people, one adult who may be a new or not new mom or parent, and then one brand new kid, fresh, have to learn how to come together. So we have to be patient with ourselves. And a lot of times we're not.
Absolutely.
No. And I have to say, I don't help a lot of, when someone saw you, Yolanda, and they came back and they said, your pediatrician's going to tell you that baby's got to gain weight. The baby's, because I was, after I gave them the spiel, like, we know the baby's healthy if it gains weight, and we're still at, you know, the 3rd week, we're not where I want. And they said, oh, Yolanda said you were going to say this. Like, you know what? I am not helping the matter, because this mom is doing everything. So we do need to back off when things are working, and we're just still trying to catch up that baby to the percentile they're born at. We try to decide that. But as long as things are slowly coming together, and I'll let you speak more on this, but you know, if it's too slow, you do need to
Yeah.
speak to someone, because there are some quick fixes that, and why don't you speak about those, what those tips are, the quick fixes that are like, oh, this was wrong and we can help you with this.
Yeah. So there are some things that we find that tend to happen in the first week or two that if we're not keeping an eye on it, if babies slip through the cracks. One of them is we do expect babies to lose weight, but there's a bottom and we don't want to keep dipping below it. So making sure that you're getting your follow-up checks with your pediatrician, making sure you have, before you even deliver, some kind of breastfeeding help support
Yes.
already in place
Yeah.
before you deliver. So you know who to call when you're like, wait, something's wrong.
Yeah.
The other kind of quick fixes are remembering that positioning, how you position your baby at breast could make or break it. I.e., a lot of times if we're on our second or third baby, we try to put our brand new baby to the breast in the same position that a toddler would feed. And it doesn't work, or our nipples are getting sore, or the baby's not drinking well. We have to meet our babies where they're at. So babies that come a little bit early, we need to be careful with position. So to me, the quickest fix for a lot of things is having that expert that can look at that and say, hey, maybe tilt your baby this way, maybe lean back a little bit, maybe lean forward a little bit, maybe shape your breast more like a hamburger as opposed to the opposite direction. Those are the little tricks that we use. And a lot of times the baby grabs on, and usually once the baby gets it right, mom goes, oh, wow.
Yeah.
Okay, I got it.
Absolutely.
So those are usually things I say is just make sure you kind of have some help in mind. And nowadays we've gotten pretty savvy with it. It doesn't have to be a whole in-home consultation. We have a lot of clinics right now that are open and available. A lot of hospitals have services, and then a lot of virtual availability. There are apps that are available for help as well. So it doesn't have to be a big full-on thing to get what's really kind of simple questions answered.
Absolutely. And like Dr. Vivi, you mentioned, you were kind of admitting that sometimes as providers or pediatricians, there's, this has to happen, and the weight has to be this, the weight has to be that. Well, one of the things I love about you is, you spend so much time with your patients. And so when that baby comes in, you're observing the baby with mom. Having a relaxed pediatrician can really play a big role in the success of breastfeeding. So if that pediatrician, yes, they're watching and they're monitoring to make sure things that are okay, but if they're relaxed enough to say, okay, let's not panic, these are the things that we can do, this is how we can help your baby, is so huge. It's so huge. We would even love to hear from you. How do you, in assessing your patients, how do you kind of put them at ease and let them know that they can do this?
Well, Elaine, thank you for the compliment. I am very blessed with extra time with my patients, and it's what I chose. But I was going to elaborate on Yolanda's points, because they're all points that I learned from her and have emphasized with my patients, because I see them making a big difference during the feed. But I have to also comment that as a new mom, it's on you to communicate well with your pediatrician. If you're struggling, I had a mom and dad, and I thought that I couldn't tell why they left my practice. I thought dad wasn't happy with something. A year later, they came back to me because they really liked the practice. But at the time, the mom was not showing any signs. She wasn't letting me know that she was stressed. She seemed way too relaxed about her baby's weight, and the baby was losing. I consulted another pediatrician who gave me the worst advice. She said, you don't carry that worry home. Because I worry about my babies, my patients like my babies. And she goes, you don't worry about that. You make that mom worry. And so I laid it thick. And that it was way too much for her at the time. But there was no facial expression to me that she was even worried about the weight. So it is your job as a new mom to also be an advocate for yourself.
Yes.
So, I'm doing a lot here. We advocate for our kids better than ourselves, but you have to start to learn how to advocate for yourself, because put your oxygen on first, right? It's always like pandemic. That's gone through my head a million gazillion times. I still can't do it, but you look at your husband. He can do it. You can do it too. They're great at putting their oxygen on first.
Absolutely. Yes, they are. Yes, they are.
so jealous that my husband sits to his 30-minute breakfast, and I'm like, oh my God, I barely get lunch in my mouth. And he's right, though. How is he going to function and be a good person during the day if he's hangry? So we got to take care of ourselves. And Yolanda, your points. So what I see in my office, and these are only things I picked up from going to your class a dozen times. Their bodies are so misshapen while they're holding the baby. You pointed out how are you going to maintain that you're going to have a tight neck. You're going to hate breastfeeding. You're going to get a pinched nerve. So the dads need to be equally present, putting a pillow where they need it. Get that breast friend that is like the life-saving pillow.
So wonderful. So wonderful.
All things I learned from Yolanda. But get a good, healthy, comfortable position, because you're going to be doing this for like 6 hours of your day, if not more.
If not more.
And so you need to have good ergonomic. And then the hamburger, I don't know if you ever compared it to an apple, but we've all bitten into that huge apple and like ripped our lips. We're like, ow, can't get it. So make it a sandwich. And I even explained this to a parent, and they put the hamburger like this. I'm like, no. It's like, So explaining how you would bite in, you have to really show them how you're biting in. Make sure your pediatrician checks the tongue movement, right? That's right. Going to be,
and that's a blessing if you have a pediatrician that's even willing to look at that, because some pediatricians are absolutely unwilling to even broach the subject. So have them check the tongue movement.
Say you want that. By the way, I'm taking notes on the things you're saying in the comments. So I'm just going over what the tilt and the holding. Pediatricians are not well versed in these different holds. So if you were taught to hold the baby in a certain position, go with it if it works for you. Because sometimes I'm like,
what works for you. In general, the take home, the quickie that I tell parents is think ear, shoulder, and hip in a straight line, because we don't eat like this, right?
Right.
We eat facing forward. You don't want to ask your baby to eat like this.
Right.
And then if I ask them, like, turn your head, try and swallow. Like, if you turn your head and try to swallow, it doesn't really work great.
Yes.
So once parents hear that, they're like, oh yeah, kind of makes sense. So just little tips like that help a ton.
And then lastly, you mentioned something really quickly that parents struggle with, because I am there on the phone with them in the hospital every day. You need to elaborate and emphasize that you want to have lactation in the hospital.
Yes.
Especially on the weekends, which tends to be, I think, most of the times that the parents are there. You act like nobody ever in your family was able to breastfeed, and that there were so many complications. I recommend that my patients just ask for a pump, and even if they have to fabricate a story that their mom needed a pump right away, because that really gets the milk going. And that was one of my colleagues recommended for me, and it got that milk going a lot quicker.
Right.
So you get, the moment you hit your floor, or even when you are in the delivery room, you say, I need a lactation consultant. Yes. And when you get into your pediatric room, you say, did they put in the order for lactation consultant? I would say 75% of the time on a Saturday, they still don't show up, and they say, they left for the day. They're going to see you tomorrow, and tomorrow doesn't happen. So
that's Sunday. So it's really not going to happen. Depends on your hospital. But if you're delivering in a baby-friendly hospital, or a hospital that at any point offers like breastfeeding classes or things like that, then the expectation should be that you can get either a lactation consultant in your room to check on you almost every day. Unless things are just amazing, usually a lactation consultant can pop in on anybody. Are you good? You have questions, problems, or whatever. If there is no lactation coverage on the weekends, or say things are going downhill in the evenings, here's my tip. Your nurse is supposed to be trained in basic breastfeeding. So if you're just needing some help latching your baby on, your nipples are wearing down, you don't understand what's going on in your baby's behavior, ask that nurse, like, you know what, I really need some help with breastfeeding. If there is no lactation, is there like a nurse that's super good at this, or more experienced nurse that may be able to pop in and help me? A lot of times people aren't willing to ask for another nurse, because that would be crossing
Weird
lines,
vibe.
stepping on toes, or whatever. But the reality is most hospitals really, really care about patient satisfaction. And if you know to ask for it, they'll figure out a way to give it to you. So you're like, you know what? Like, I know that there are nurses in my hospital that are amazing at lactation and nurses that need a little help. And we're a baby friendly hospital. So I encourage parents, like, ask for help at night. Don't hesitate to ask for help, even in off hours. Our nurses are trained, and if your nurse isn't great at it, it's possible she knows she's not great at it too. So have her be like, hey, is there somebody else that can potentially help me that's got like some more experience, maybe with my type of nipple or with a baby that's behaving this way. And if she's upset, she'll survive.
Absolutely. And I also think that you had mentioned having lactation scheduled for when you get home, or having that consultant ready to go. I mean, take it from someone who was discharged on a Sunday, engorged breast. It was just a hot mess. But being able to get in, see the lactation consultant that next day really was just a total 180. Put me at ease, put me on a great schedule. I had twins. It helped me put something that wasn't overwhelming. It really was having like a partner to get you through this. So I think when you're pregnant, you don't know what to expect. And so I think that even if you just have one consultation scheduled for your postpartum, knowing I'll be discharged and the next day I'll be able to see somebody, even if things are going great, just having someone assess you outside of the hospital and say, you're doing awesome, is totally worth it. Totally worth it.
You guys are
so true.
You guys are so true. And I think I wouldn't have believed it until I was a pediatrician. Like, why should we all need this specialist? But people think everything's going great, and I don't see them for 3 days sometimes after the last specialist saw them, and they've been feeding with an inverted nipple, and the baby's just barely like working so hard. People think things are going great, and they're
not going great. Yeah.
There is something. I can't believe people don't get help right away, only from what I've seen. Yeah. I don't think that there's one person who could go home and do it as well. They couldn't do it 50% as well as if they had a lactation consultant.
Yeah.
Well, and one thing I learned in this process, so I did home visits for the bulk of my business for so long. I'm so used to kind of either a mom has contacted me while she was still pregnant and basically said, okay, how do I get in touch with you? And I'll literally meet them at the house when they get home, or I'll see them within a day or two. The appointment is scheduled before they discharge. So I have some moms that are like that, but then you also have moms that didn't know that there was a problem until they go to their pediatrician, and I get to hear all the stories. So it's interesting now working in a hospital, seeing how parents get there.
Yeah.
You feel really powerless at discharge, because we see in the hospital day one, sleepy baby, not really doing much, not latching great, or maybe latching great. Day two, mom still has colostrum. So maybe we're getting better, maybe we're getting worse, but ultimately so many people go home then. I don't know what happens on day three unless it's a C-section mom. So day 3, day 4, when the breast does a lot of change, breastfeeding changes, and we're not in the hospital anymore.
Yeah.
So it's suddenly like, what happened? I don't know what happened. So having that day 3 through 6 lactation is important, especially when some people don't get to the pediatrician. Say if you discharge on Thursday, you don't get to the pediatrician until Monday.
Right.
And
what happened?
Hey, everyone, your pediatrician is not watching you breastfeed. I love it. I ask them, I beg them, I say, stay, the baby's not hungry. Well, in 20 minutes, just hang out. I want to hang out. And some people actually come back they're like, actually, we're about to feed. We're going to feed. I'm like, good. And so your pediatrician isn't going to see anything. So you need to schedule something with a lactation. Once you start feeding, like, oh, I guess our session's over, I'm leaving. No, this is the time where you would love some help, but they're not necessarily trained in what to tell you. Right. So you do need some professional help. Everyone needs it, even if it's your second or third.
Yes. Every baby's different. Yeah. Can you tell?
Every baby's different.
Can you tell?
Every baby
They're all different. They grow up with different personalities. Those personalities come out at birth.
Yes.
And you guys said skin to skin,
Yes.
and what that means for everyone is baby should feed naked. Get them in, keep them alert by not keeping them wrapped and warm. So get them in their diaper, and that automatically means skin to skin. They're stimulated and oxytocin is being released. It's
Yeah.
helping your breasts develop more milk. It's helping the baby bond and latch. Dads do it. I tell all dads to do it in the hospital. Dads should have their shirts off and hold the baby. Skin to
Yes.
Yeah, it's amazing how many dads are still really squeamish about doing it, but I can always tell who the obstetrician is at my hospital, because there are certain OBs that teach that from the beginning. Skin to skin. Are you doing your skin to skin? And so these dads are the ones that are doing their skin to skin. So having the provider tell dad, let's do some skin to skin. This is important for your child. Having the pediatrician or the OB doing it, then they're like, oh, well, let me get myself together and do it. But if anybody else says it, or even if the nurse says it, they're like, just want to see me with my shirt off.
You want to see and it's such a special time too, because I think as your kids get older and you look back and you think, God, that period was so fast, and I miss the days that you could just lay there with them and just snuggle and cuddle with them. It's a really special time, and so for nothing else, even if you're a mom or a parent that has to bottle feed, you're choosing not to nurse, or you're unable to, just doing that skin to skin with your baby is extremely special. Extremely special.
Important.
Yeah.
It's
and
crucial.
I think maybe a few tips also about, people focus so much on how much and how is my baby getting enough. Just as a guideline, I like people to understand that very basically in 24, and you could, Yolanda, I'll say something quick. You can elaborate on it. We're talking about 24 ounces in a day. We want to get, so 24 ounces in a day means an ounce an hour. A newborn can take just about that, no more than an ounce. So I'll let you speak to that. But that is such a good gauge for you to know how much is my baby getting once you start pumping. But if not, Yolanda, maybe you want to speak to how often you like people to breastfeed in the first few days and weeks.
So, and that's often the big challenge for some of our parents, because they really want to know exactly how much their babies are getting. And that's, if that's the case, then you end up with a mom that's like, you know what, I think pumping is going to be more for me. Setting the expectation for that mom, recognizing when you pump in the first 24 hours, you may not get anything. The pumps are not that effective in the first 24, 36 hours. Hand expression may be better for you. Setting that expectation is important, that they may have to do a little bit of supplementing in the beginning before that milk supply is full tilt and we're able to really nourish the baby with exclusive breast milk. But for moms that are directly breastfeeding, it's kind of my shebang every day. So everybody wants to know, how do I know my baby's hungry? And how do I know my baby ate enough? And the majority thing I hear every day in every room is, I don't think my baby ate enough. So usually what I say is, look for those hunger cues. Your baby's telling you they're hungry before they start crying. So they usually are smacking their lips, they're putting their hand in their mouth, they're looking around, even in their sleep. They're literally asleep. They're giving you the cues, and that's your last minute stand, like, oh, let me bite this sandwich because this baby's going to be up in 10 minutes. So that gives you a little time to try to get set up and get your baby to the breast. So look for those hunger cues. Typically a textbook answer would be, your baby will do 10 to 15, maybe 20 minutes per breast. Now I tend to teach a dinner and dessert offering. Babies are not born with watches. They don't care what time it is. They do not have appointments. So they're going to come to the breast when they're hungry, feed as long as they'd like, and usually around 15 or 20 minutes, they're done. And you burp them, but they're not full. You burp them, and then you offer the other breast. So if you offer dinner and offer dessert, the large majority of the time the baby is actually full. And we start to see what looks like feeding 8 or more times in 24 hours. Now, what we used to say is every 3 hours, wake your baby up every 3 hours. What I find in the first 24 hours is you have parents panicking because they cannot wake their sleepy baby up in the first 12 hours. They're sleepy. So I'm focused on skin to skin, especially in the first day. Keep your baby near the table. Don't swat them up and put them away. Like, keep your baby near you. Look for those cues, and you'll be ready to feed when your baby's ready to feed. But overall, if you're keeping track of, okay, I'm tracking it, and some people do it on their phone. Some people just write it down for the first couple of weeks. Oh, my baby, it looks like my baby ate around 8, 9, 10 times in a full 24 hours. Then I'm thrilled. And then ultimately what I'm looking at is diapers. Because the idea is, if the milk goes in, it should come out, right? If there's nothing coming out of your baby, then there's nothing going in. And I have to actually remind parents of that. I'm like, if you have a 4-day-old who is only peeing one time, what does that mean? And you'll see them go, oh, the baby's not getting enough milk. Exactly. So, I teach them on the first day, look for 1 pee, 1 poop. The second day, 2 and 2. The third day, 3 and 3. The fourth day, 4 and 4. It's an easy way to remember, to recognize as we make more milk at the breast, the baby eats more. We see diapers more and more every day. Usually they can keep that in mind because it's simple learning. And it starts to have them trusting their breasts a little more. Like, oh, wow, look, the baby only needed to pee 2 times today, and the baby peed 3 times today, pooped 4 times today. Look at there. We're doing good. So those are the things I usually teach to kind of help them know their baby's getting enough. Because if they're eating enough, frequently enough, for enough time, not 2 minutes, then they usually make diapers.
So am I driving my patients nuts when I prepare them for the first 24 hours and I say, get that baby up every 2 hours during the day? So I say, okay, well, because I hate 3 hours. If you go 3 hours, there's no way that they're going to get the baby on their skin and get their milk coming in. So it's like when you are fresh in the marathon, your first miles, just, you have all this energy. I want them to use that and get used to the day, if they're not sleeping, put that baby on you that's what I say. If you're not sleeping and you're up, put that baby on your breast every 2 hours. I don't want them on the breast for 2 hours, but you're saying, and I have seen I've heard people say, just if they're sleeping the first 24 hours, that's normal.
Well, it is, quote, normal, but I think that we also have to realize that birth is not normal. Like how we birth our babies traditionally in the United States is not normal.
Yeah.
If we have a vaginal unmedicated birth, that baby looks very different than the baby you labored over with epidural medication or different medications, or moms with high blood pressure or failed induction. These are different deliveries. So generally, I don't look for babies to not feed for 24 hours. That's a little on the long side. If we have a baby that's sleepy for 24 hours, I'm all on the skin to skin and the hand expression and, trying to get a little bit of colostrum in the baby. But a lot of times they are sleepy for 12 hours. And I have these panicked parents. Baby's not peeing, baby's not. And I try to set their expectation more towards normal. Like, it's okay if your baby is not starving to death every 2 hours in the first 24 hours. They tend to want formula immediately. And that is a normal baby that may not need formula yet.
Right.
So if a mom is advocating for formula and she wants it, okay, it's fine. If that's in your plan, that's fine. But if I have a mom that came in saying she wanted to exclusively breastfeeding, she's not exhausted, I try to educate her first before she flips out and, oh, okay, this is normal. Yeah, this is normal. We're going to keep an eye on your baby. We're going to watch your baby. So take it easy on the moms.
Okay. Well, I'm not saying they have to have a successful feed, but I want them to try every 2 hours. Is that not?
I tend to say 3, but I also want them skin to skin more. They need to be skin to skin. And a lot of times grandma comes in or nurses are coming in and we're taking the baby from mom, we're wrapping the baby in a super tight swaddle and putting the baby away.
Yeah.
And a lot of those instincts to feed get suppressed when we do
Yeah.
that. They're not feeding often enough, which is part of the problem. So you're going to get more of that feeding as soon as we get those babies close to us.
But I do say nighttime, give it 3 hours, because 3 quickly turns into 4 by the time they've gotten ready and got the baby on them. 2 quickly turns to 3. So, so that's why I do that. But I guess I can feel out the parents and maybe give them day 3, get on that. So,
yeah.
Any closing tips that you find are really high yield on breastfeeding in the first, even the first month or 2?
Okay, let me think. So I wrote down a couple of things. The main one is, if you know you want to breastfeed, even if it's mixed feeding, take a breastfeeding class, because just having some understanding of the process of milk making, and then having some understandings of what it might be like to hold a doll in a position near your breast, and then also getting to know your breast. A lot of times we walk around here just carrying them with us, but we don't have any idea what kind of nipple we have, or what kind of challenges might come with the types of nipple that we have, or that each nipple is different. So, you know, by being in that class, that starts the process of thinking about what your goals are going to be, how you're going to feed your baby, what plan you may have. And if it's combo feeding, that's still a breastfeeder. That combo feeder is still a breastfeeding mom. So all of it's good to do some prenatal education. And that way, when you deliver, not that the information is fresh, but when you hear it again, because it's all about educating, it'll be easier for you, as opposed to hearing it the very, very first time right after you deliver and you're literally in a hormonal fog.
Absolutely.
Great.
So that's my big tip. I feel like if it makes all the difference. I can see the difference between a mom who did some prenatal education and a mom that did not every day.
If someone wants to reach you, you just have them reach out to you on PhD Milk.
Yeah, they either go to my website and they send me an email and I get it right away because it goes to my Gmail, or they call me. And I end up with a lot of moms nowadays. We're texting. They want to, all right, how can, and it's not necessarily texting your health information. You're just texting the schedule. So I'm fine with that as well. Some mommies are not quite ready to do in person. So we're doing some virtual consultations. We're doing a lot more virtual, a lot more phone than I've ever done. And then, you know, some people do have questions about your vaccine status because they want to know whether you're vaccinated coming into their home or not. So, you know, I'm very clear and upfront about that. And that's generally how we move forward.
Okay, great. Well, please stay with us because we want to know your favorite 5 accessories, or just a few of your favorite accessories. But we're gonna move on.
One breast, other breast.
Your 2 favorite accessories. That's great. We're gonna have Elaine talk to us now that she's with the Cradle Company. It's a perfect topic for you. We're going to talk about newborn care specialists and explaining the difference between a night nurse, a postpartum doula, and a sleep consultant. These are things I want to know too.
Absolutely. Well, you know, a big reason that I joined the Cradle Company and said, our founder is Brandy Jordan, and she's been doing this for a long time. She's been based out of the LA area, not really marketing or needing to. It's just really been word of mouth. And we're friends. And I remember saying to her, you know, we need this in Orange County. We need this in San Diego. And actually, we need it everywhere. But a big reason for me, I think that my love of working with women and working with families, and working with families in general, and working with parents comes from the fact that I have noticed that my patients don't have a support system after they give birth. They don't have a support system after they adopt. They don't have a support system after a surrogacy in their home. And that was never more true to me than after I gave birth to my own children. I'm West African, and so that village and that support system for me and from Ghana was instant. It was just It's just what we do in my culture. And so you have a baby and everyone surrounds you and that village is there for you. So there's someone there to help you with the baby during the daytime. There's someone there to help you with the baby at night. And just like Yolanda was saying, birth in the West, specifically in the United States, looks very, very different. And in this culture, parent has a baby and you go home and you're isolated and you're by yourself. So the services that we offer through the Cradle Company, and there's many wonderful companies here in Orange County and Los Angeles that have been doing these services. And I'm excited that for all of these companies, I'm excited that these services are coming to light more. I think that for a long time in this culture, having help has been seen as a luxury. Having help has been seen as you don't want to do it yourself. Oh, you must be a lazy parent if you don't want to do this yourself. And the reality is that's just not the way it is in most of the world. Most of the world, it is such a communal effort to raise children. It's such a communal effort when you first come home. Many people, sisters, aunts, cousins are surrounding you and they're doing this with you. Mm-hmm. So that just segues right into, what's the difference? People hear the word newborn care specialist. They hear the word postpartum doula. What is that? So I'll start with newborn care specialist. That has been commonly known as the word night nurse. And now, legally, that's not a term that you can use for someone unless they truly are a licensed professional and they have that title of a nurse. But a newborn care specialist is someone who is trained in working with infants. They're trained with working with families. They will come in, and usually they'll come in around anywhere from 8 o'clock at night to about 10 o'clock at night. They will help the parents develop what are called healthy sleep habits. We don't really advocate, and Dr. Vivi, you can attest to this, but we don't really advocate sleep training per se, right off the bat. You're not going to come home. If you're having to wake up your baby and nurse throughout the night or bottle feed, we're not going to advocate that your 1 week old is sleeping 12 straight hours and on a strict sleep schedule. But we do want to teach you what do healthy sleep habits look like. So having a pattern, singing to the baby, reading to the baby, the parents have a pattern of what they do before they wind down. These are things that a newborn care specialist will help you do.
Elaine, I lost you for the last sentence.
Okay.
The internet came in and out. The newborn care specialist is trained in working with infants and families.
And they're there to help you develop what's called healthy sleep habits. So I don't know if you heard me talk about that. We're not going to sleep train a newborn, but what we do want to do is start to develop healthy sleep habits. So what does nighttime look like? Is it a bath before bed? Is it reading to the baby before bed? Just having a routine, even when you start early, is very healthy. So that's one of the things that a newborn care specialist will help you do. When mom or parents are sleeping, newborn care specialists can help you. Baby wakes up, they can bring baby to you. They're not lactation consultants, but they can help you with, positioning. They can help you put baby to the breast. They're there as a partner to help you. Oftentimes, your partner may be traveling, your partner may be sleeping because you're taking a different schedule. So they're just there to really support the parents so that they're not completely sleep deprived. I think anyone who's had a child can attest to the fact that that lack of sleep the first few months is debilitating. And so having someone come into the home and just support you through that. So, parents can feed baby, the newborn care specialist can help burp baby, parents can go back to sleep, get some rest, they can help clean bottles, they can help organize. They're really there to be a support system, physically and emotionally for you. Okay. A postpartum doula is very similar to a newborn care specialist, and in many ways they will pick up where maybe a birth doula left off. So where the birth doula was there to support the parents through the birthing process, the postpartum doula is going to be there to support you in the postpartum process. So again, they may come during the daytime. They will help with light cleaning, organizing, because it seems so silly, but that is very overwhelming. I think if anyone remembers coming home with your baby and suddenly you have pump parts and bottles and laundry and all these things that need to be done on top of, now we're telling you to do skin to skin all the time, but you have to clean it. It's overwhelming. And your partner's going, what's going on? Our life used to be so great, So having someone that can come in initially and say, here's how you organize, let me hold the baby for a little bit so you can go take a shower and I can be loving with your baby, kind with your baby. A big part of what they do is let me help educate the grandparents, because grandparents come in with their own mindset often. And they'll say, we do it this way and we do it that way. Sometimes having an objective person come in and say, let me help you. This is a way that you can help change diapers, or you can do this. It's really just someone, that objective person who doesn't have a personal stake, is there to be just a real support system for the family.
Great. And someone like that be more important for someone who has a C-section and has a lot of ongoing care with their site, or is that not part of what they're trained in?
That's absolutely what they can help with, because again, if mom has had a C-section, or even if the parent has had a vaginal delivery, but there's been a lot of trauma in the perineal area, she's going to be tender. Movement may be difficult for her. So even if it's a vaginal delivery, having a support person, it can really help even cut down in the risk of postpartum depression, because and again, as Yolanda said, breastfeeding is normal and natural, but it's new. And having a baby, even your second baby or your third baby, each experience can be different. And just having a support person that can come in and say, because you want to focus on that skin to skin, and because you want to focus on the nursing, let me be here to help you with all of the peripheral things that need to happen. Let me be here to help you and your partner, so that your partner is not also overwhelmed, so that you guys really can be together and focus on the baby together, and everything on the outside I can help you do. So
that's kind of my understanding too. And I've kind of been out of the doula world for a little while now. I think the way that I was taught to think of it, the difference between a postpartum doula and the newborn care specialist, is a postpartum doula really is for mom and dad, or
it
parents.
Is, yes. Yes.
It is the person that's there to care for and nurse your parent. And that may not involve you touching the baby at all.
Yeah.
I remember that when I was a postpartum doula, it was very much so, mom, what do you need? And as a postpartum doula, you may not be involved with the baby at all. You may be involved with like cooking and the cleaning, or, keeping sure that mom actually does eat a meal.
Yes.
Oh, yeah, that's fun. Yeah. Hydrating,
Yes.
and all the things that are important to maintain breast milk and your sanity.
Absolutely.
Yeah, sanity. Yeah, because moms tend to focus so much on baby that they don't have the resources left to focus on themselves. And literally that's what a postpartum doula in my mind was trained to do. I was not a newborn care specialist, so I know very little about that. And I didn't realize that was the same thing as your kind of classic night nurse.
Yeah. It's just
the night nurse always sounded like someone that would literally come in at dark and then leave in the morning. It was this very
yeah.
What happens here?
I've actually
what goes on at night?
Someone who sleeps. They come over and sleep in the night while your baby's sleeping. So I was like, well, that's what I'm going to do.
Right.
So no, these are good distinctions. And then there's still the last is a sleep consultant. Do you guys have sleep consultants at your office?
We do. We have wonderful sleep consultants. And a sleep consultant is often going to come in when the baby's a little bit older, maybe around 4 months. And if the parents decide that they would like help to really get baby on a healthy sleep schedule. One of the things that I always want to stress to parents is that this is also something that you want to discuss with your pediatrician, because some babies may have certain conditions that they're not ready to sleep 12 straight hours, or they're not ready, you do need to wake them up and feed them at this time, or they need to sleep in a certain position. So I would always discuss it with your pediatrician first and say, we're thinking of sleep training. Is baby okay? And usually you'll know in advance that there may be some issues, but definitely have that conversation with your pediatrician. We're getting ready to sleep train. Just want to make sure that we have the medical clearance and there's no issues. So assuming that there are no medical issues, there are many different ways to sleep train a baby. Just like there are many different ways to potty train. Some kids do great with the 3-day method, get naked, do it. And some kids, it's a long, slow process, doing a little bit each time. And so I think it's important for parents to do their research and decide what method they will be comfortable with. Remember, again, In the West, we tend to sleep separate from our babies, whereas in most cultures, co-sleeping is a big thing. I'll say it. I was a big co-sleeper with my babies. I was nursing. It's just it's just what I did. And so because of that, I think we just view sleeping a little bit differently in this culture. And I do think there tends to be a rush for parents to feel like, I have to hurry up and get this baby sleeping from 7 to 7 every single night. And if my baby's not doing that, there's something wrong with my baby. And that's not necessarily the case, but that is a huge benefit to having a sleep consultant come to work with you. They will come in, they'll talk about different methods, depending on the parent's comfort level, and they will help you find, again, an approach that is best for your baby and best for your family. And a lot of times that's going to start with just very healthy sleep habits. I always tease my husband because one of the things he'll do, even putting our toddler to sleep now, is he'll go from like 0 to 60. It's like, okay, it's bedtime, let's go to bed. And he thinks he's just going to put this baby to bed, and he'll come down and go, oh, that was so rough. That took me 45 minutes. And I'm like, well, you didn't read to him. You didn't do a song. You didn't do a routine. And so having a good routine is going to be very important for having babies that have healthy sleep hygiene, right? So that is something that a consultant can come in and work with you to say, what do the surroundings look like? What is your emotional state like before you put your baby to sleep? And oftentimes it can be a 1-week process. It could be a 6-week process. Every baby's different.
Great. We're going to move on to our last topic, unless you have something else that you think needs to be said.
No, I think the biggest thing that I want to say is that, again, I hope that as a culture, we can get past thinking having lactation consultant is a luxury. I hope that we can get past thinking, having support in the postpartum for the parents is a luxury. I hope we can get past thinking, having a pediatrician that spends time with us and really examines the parents and the baby is a luxury. Because these are all things that are very important to be successful in the postpartum. These are all things that will help to decrease postpartum depression. And that's what a big part of why we're here today talking, is to normalize these things for families as they have children. So thank you for the opportunity.
Yes. This was, I was trying to really focus on medical doctors, but as I do these shows, I realize that the resources are much thicker than just what the doctors have to say in their office. And this is so important for success as a parent. So we only have a few minutes. I wanted to share my favorite accessories, but we started the show beautifully with trusting your instincts, believe in yourself. That goes for any type of parent. If you're a worrier, whatever you come from, you got to trust yourself. Doctors give bad advices, nurses, lactation consultants give bad advice. If you feel like something's wrong, get another opinion. That's so important. And trust yourself. If you think something's wrong and your doctor says, no, it's fine, make sure that they've looked at everything. And then I did a talk with an ear, nose, and throat doctor and confirmed that putting saline in the nose is just a beautiful thing, can be super helpful. I have a patient who thought I was amazing because they had a colicky baby who only for 2 months was living life with terrible mucus plugs and was gassy. So I love this. People use the nose Frida. I love this Nespira. You can suction and clean it. You don't want to suction more than once a day if your baby doesn't have a sickness, because you can really get these nostrils swollen. But even just saline alone, and there's special saline you buy that is for newborns, and it's a spray in the nose. So do it. And you can do it early. You can ask your pediatrician for help. I don't have Desitin 40%, but this is, I think, the Amazon knockoff. Definitely not as good. It's separated. So get the purple Desitin. It's every time I waste so much breath on this because someone's going to use the A&D and come back with a rash. I am 100% on the 40% Desitin. I don't think anything else works, but that's my professional opinion. The Breast Friend is a pillow that really offers back support and allows you some freedom. And in the newborn,
took one of mine.
Well, I probably learned it from you. Okay, this is Yolanda's, and you want to. I love using a swaddle under the head for your comment about keeping the baby in a line. You want the ear, chin, hip, all in a line. Shoulder, sorry. And then you guys talked about co-sleeping, and I love these co-sleepers that have a hard, rigid edge,
Yes.
mesh, or breathable for the first 2 months, because
Absolutely.
it gives you some sleep. You can hear the baby moving. No one's going to roll on the baby because it has a hard protection. And they can even have a lift for reflux.
Yes.
They fold up. They're super small and compact. Okay, those are my 5.
Nice.
Oh, those are my 4 and Yolanda's 1.
Okay.
Elaine, do you have any excessive?
Yes.
I
Okay.
have others. I could take yours. I love.
Okay. Well, you stole my nose, Frida, because I just adore the suction. You know, when you have a sick baby and you can't give medication because they're too young, you're right. Nothing beats saline and suction and a little steam and shower. It's amazing. So that was on one of mine. My number one thing I would say, other than having a lactation consultant scheduled when you get home, is make sure you have a really good stool softener when you get home from the hospital. No one talks about the constipation.
Yes.
The constipation is real. It is real. And it's real if you had an epidural. It's real if you had a C-section. And it's real if you had a unmedicated vaginal delivery, because you might feel a little bit tender and you might feel nervous. You may have hemorrhoids. So you do not want to make things worse. I'm a big fan of magnesium. As always, speak with your doctor or your midwife. Make sure that magnesium is okay for you medically. But I'm a huge fan of magnesium. It naturally softens the stools. It doesn't cause cramping or diarrhea. And that's just a really great, you don't want to get home, be constipated, and be dealing with everything else that's going on. So that's my little secret. And I'm curious, Yolanda, how you feel about this one. I love the Haka pump. Or you don't know how you.
Yeah.
Do you like those? I don't. Okay, I see. Okay.
I do like the Haka pump. Man, that pump is popular mainly because it's so affordable.
Okay.
Like, everybody can have one. I feel like a lot of moms are disappointed in it.
Really?
Something like, yeah, because it doesn't necessarily work for every mom. It doesn't sit well on every mom. But for the moms that it does work for, they love it. I always kind of have some caveats.
Okay, I'd love. Okay. Our next episode. But for me, what I love about it is that when you're nursing, you often have that letdown on the other breast. So I didn't use it specifically as a pump. I just use it to catch that letdown. And it was like an extra 2 to 3 bags a day that I didn't have to pump. Wow. So it's like free milk. So I was a big fan of the Haka pump. And
you only have 2 more
minutes.
Okay, Yolanda, you go.
Yeah, like you were using it in the right way. So when you use the Haka, don't steal milk from the baby. Some people are putting that Haka on at the beginning, and then they wonder why their baby's not eating enough. And it's like, because you have the milk in the Haka. So don't steal the milk. So the breast friend was the first one. Like, that's my primary. I'm a big fan of the breast friend pillow. I know I'm probably not even supposed to say that, but whatever. It's a great pillow. All my moms love it. The other thing is having a nipple cream handy. So preferably one that's organic, food safe, no Vaseline or anything strange like that, because you're going from nothing touching your nipples to something touching your nipples 8 to 12 times a day. You might be tender. So have some nipple cream or a gel pad or something for nipple care, and then have a breast pump. Like, go ahead and have one. Even if you don't necessarily plan to pump, the need to pump generally comes up in our culture, in our society. So have a pump on hand through your insurance. Don't pay a nickel for it. It should be free.
And they all are hospital grade. That's just such a funny term.
Most of them are now, yeah.
Well, what's the difference? And I talked to some of them, like, no, they're all, I mean, and I've used a lot. They all feel the same. And everyone's going to have a different experience. Well, ladies, thank you so much. We only have a minute to spare here. I just can't tell you how much you've done for some of these moms. Everyone remembers that period. Parenting is hard all through the years, but it's like they throw the hardest curveball at us right in the first month, and having people like you to get through it is invaluable. So, yeah.
Thank you for having us. It's been a pleasure.
Thank you for being here. I have a few questions from some people who are watching, but I will send them to you
Okay.
I'll send them to you separately and get back to them. Thank you. Have a great day, you guys.
Thank you so
Take
much. Thank you,
care.
everyone.
Yeah.
Bye.